All right. Okay. Well, thank you everybody for joining today's webinar on metabolic testing for holistic weight loss in clinical practice. For those of you that don't know me, I'm Jason Madden. I'm the campus manager at IHN Vancouver, as well as the program advisor for IHN Online. And today we are joined by Dr. David Duizer. So Dr. Duizer, he earned his bachelor's in science from the Royal Military College of Canada as part of the regular officer training program back in 2008. He then graduated from the Boucher Institute of Naturopathic Medicine in 2014, where he currently serves as chair of the Board of Governors. He is the co-owner of Noble Naturopathic here in Vancouver, where he has a private practice focused on integrative chronic disease management. And as you probably heard us chatting about, he has a weekly podcast called Healthy Rebel Radio. He's also the medical director of online natural weight loss program, DHEA Health. Is that right, David?
That's correct, yeah.
And his supplement line, which he just launched in 2020, Noble by Nature. So he's a busy guy with doing lots of things, and we're so fortunate that he's lended his time to us this evening. So David, I will throw it over to you.
Thanks for the intro. Hi, everyone. Okay, so today we're talking about labs for holistic weight loss. This is one of my favorite seminars to give. I really like giving this one because it's not something that's done conventionally. It's something that's only done in integrative medicine, which is what we're all practicing. So to give this seminar to nutritionists is so exciting because this is one of the key reasons that people will see you is for weight loss. And so it's just excited to be presenting this information. What I'm going to do here is share my screen. Okay, so perfect. Okay, so here we go. Laboratory testing for holistic weight loss in clinical practice for nutritionists, holistic nutritionists. The question I'd like to start with is, if we all want to be lean, we all want to be a little leaner, why are we not achieving that? It's one of the main questions you'll get in clinical practice is like, I have been trying forever and ever to lose weight, and I just can't either get it off, or once I get it off, keep it off. And so part of a practice of chronic disease management is helping people become lean. And so I've been doing this every day for 6 years now in my naturopathic practice, and online as part of our online weight loss program for 11 years now. And so I've got lots of experience with metabolism support, and I'm thrilled to share lab assessment with you. How can you use this? This lecture seminar is for difficult cases. So basically you have people who feel like they've plateaued, feel like they can't keep the weight off, don't respond to the calories in versus calories out model, which is you put them on a deficit, what you think would be an excellent deficit for them, and they just don't lose weight. It's so incredibly common, and that's why the holistic approach is so exciting. The labs support the holistic approach. So let's do it. Let's jump into it. If you have questions, put them in the comments there, and we'll answer them as we go. Don't be afraid to interrupt. Okay, so like Jason said here, I've got a supplement line called Noble by Nature. You'll see a little immune stack here, which is vitamin D, vitamin C capsules, zinc capsules, and astragalus capsules. It's a 4 supplement stack. We're doing a giveaway for one lucky person here. So just by being here, you've entered the draw. And at the end, we'll choose someone, I believe is how we'll do it. Correct, Jason?
You got it.
Oh, awesome. Okay, great. Okay, good. Here we go. Okay, so as a preview to what's going on at IHN next, I'm teaching the upcoming continuing education course, Laboratory Diagnostics in Clinical Practice. What you're seeing here today is a little snippet from the metabolism, from the endocrine section. And so we look at all of these labs in detail using a systems approach. So the systems approach is, how can we look at a nutritional plan holistically in a way that will be clinically effective? And the way to do that is to be really, really good at reviewing labs quickly. Now, your job is not to diagnose. Your job is to be functional support on the holistic nutrition side. And that's what this course is about. It's about knowing more than your patients, or your clients, I should say, for for the specific labs that they're trying to improve upon nutritionally when they consult with you. And so the course will be laid out with 3 ideas in mind: the pathology component, functional and diagnostic assessments explained in a logical, easy to digest manner. So we're looking at conventional labs and functional labs that will come across your desk every day in clinical practice. You want to know more than your clients, and you want to be really, really efficient at providing nutrition plans that are specific to the numbers you're seeing on the page for the purposes of correcting. So it's a little bit of an evidence-based approach to functional and conventional lab improvement. We're going to be looking at at clients as individuals. So when you look at functional labs, you understand how this systems approach is really, really important. So that's the holistic part of it. A different nutrition plan for each and every person, and a path to healing. So we're going to be heavily focused on building your treatment notebook throughout the course. A lab comes across your desk. What's the perfect evidence-based nutritional protocol that would be suitable to this client in front of you? And that's how we're going to evolve. I've taught this course before where I've simply gone through the labs, what they mean and what the appropriate values to meet are. But I think the evolution of this is, how do we properly build nutrition plans that are evidence informed to improve these results? And that's what we're going to do in this course. It's going to be really exciting. The style of course you'll see today, it's looking at condition management and systems management. How do we functionally improve people's wellness through nutrition? Really, really excited to do that. Details, I guess, will be at the end of the seminar today. Let's make sure I didn't miss anything. Oh, how will this course be super helpful for each clinician here? You want to continually expand your knowledge so that you can perform at a very, very high level. And this high level, my opinion is, from a holistic standpoint, this high level is only facilitated by objective scoring. You can be really, really compassionate and empathetic with your clients. That's extremely important. You can be really good at reviewing research for specific conditions. But what you want to be able to do is treat the person as an individual. And that's what this course will allow you to do. That's my little spiel. I'm excited about labs, if you can't already tell. Okay, what about me? Okay, so I had a little bio already. Thank you, Jason, for that. I practice chronic disease management. I've got a sort of a special aspect to my practice, a clinical focus, which is that I do metabolic assessments here. We have a CART test where we can do resting metabolic rate and active metabolism testing, which we'll get into. So it's allowed me to become an expert in metabolism. So basically, the ability to hack metabolism to allow people to actually achieve the weight loss goals they're trying to get at. We have the tools here that facilitate that beyond conventional and functional labs. We actually have in-office functional lab for metabolism. And so that, I've had it for a year, and you get very, very good very quickly at allowing people to lose weight when you know what their metabolic rate is and you know how their metabolism responds to exercise. So that's been my year, and I'm so incredibly passionate about it. We'll talk a little bit more about it later. I'm deeply connected to the naturopathic profession. In fact, Jason mentioned I was the chair of Boucher Institute of Naturopathic Medicine. I'm now the vice chair of the Canadian College of Naturopathic Medicine because we had a merger at the end of last month. So I'm heavily involved in the education of naturopathic physicians, and that's where my real passion for the objective measuring and protocol comes into play, and that's how I'm trying to have a positive influence on our profession side. Okay, laboratory testing for holistic weight loss, understanding metabolism through a systems approach. This is my favorite way to look at the difficult case. Today we're going to cover a series of systems of the body that all play a role in optimal metabolism. We'll cover thyroid and sex hormones and inflammation and stress and sleep and nutrition and actual metabolic rate. If you need further support, don't be afraid to reach out to me. We can provide some sort of contact for me later on. I may have put my email at the end of this. If you have specific questions, I like to make myself freely available for any practitioner who needs support. And so there's only so much we can do today. I'm sure you're all going to have questions about specific values to actually get into the nitty gritty, which is to say, what's the optimal value for each of these metrics we will review. But if something comes up and you need some naturopathic support, please know I'm always here. Noble Naturopathic at Broadway and Spruce in Vancouver, and online at the emails and the socials that you'll see at the end. Okay, don't hesitate to reach out to me. I'm highly accessible, and I'm just slow on the email responses. Let's do it. We're going to jump into it. Okay, so here's the case, right? Client comes in, has a really hard time losing weight and keeping it off. This will be part of your day-to-day practice likely, because it's so incredibly common. 2/3 of Canadians are either overweight or obese by the BMI scale, which is going to be detrimental in the next 20 years to our public health system. We have to help people get leaner. We have to be, as integrative practitioners, we have to become efficient at helping people lose weight. And so I hope today you get some insight into how to make weight loss plans more specific to the individual, because like I said, this case that we'll work on today is something you will see over and over and over. The thing that you'll see the most when it comes to a case like this is that a person comes in and they say, I cut calories, I do intermittent fasting, I've done keto, I've worked out for hours and hours per day. I've had success sometimes, couldn't keep it off. Other times I've done dramatic restriction and nothing has changed. You'll see people who come in and say, I only eat 800 calories per day and I've been doing it for 6 months and haven't lost a pound. This is really, really common. And you'll say, okay, we need to do a diet recall, right? Like what are you eating? Is it actually 800 calories? Let's do a count and figure it out. And it turns out it actually is. And they're telling the truth, and they're speaking from a place of extreme frustration. Let's help them get through that frustration using some objective measurements. Okay, this is how we do it. So the baseline, after you figure out what they've been through, you have looked at the type of fasting that they have done, the type of restriction they've participated in, the type of exercise that they've done, and sort of the metabolic history that they have in terms of past medical history, family medical history, experience in sports, diet trials, for example, doing all sorts of different timing and food type restrictions. What the heck is next? Well, you need to take their weight, of course. You should think about doing the body mass index, just because it's a quick and easy measure to not necessarily categorize someone, but set a really, really great goal. You're probably thinking that body mass index is not super reliable because muscular people tend to be closer to the overweight category. It's relatively rare, and they need to be super duper muscular to be in the overweight category and be healthy. So it's helpful for setting goals if you do body mass index. It takes 2 seconds to do. Relative fat mass, which I can share the calculation for you, is an easy way in the office to do a body fat percentage and to set some goals around fat loss. Okay, waist to hip ratio is clinically one of the absolute best things you can do to help someone experience the benefits of a healthy nutrition plan. What is happening with the waist to hip ratio? It should be improving over time. If you're seeing body composition change through muscle development, that's good. The scale won't change. You say, people say, I'm gaining muscle, so the scale's not changing, and I need to stay focused and be on plan. How do you motivate someone to stay focused? You do waist to hip ratio, because if they're really experiencing a body composition change, you'll see some movement there. And then bioimpedance scales. So you'll see these scales that people step on. It tells them how much muscle mass they have and how much fat mass they have. I used to think it was totally bogus and that the commercial ones weren't that helpful. Then I got one, and I think it's awesome. So I don't know how much weight to totally put into it. Like mine was like $30 on Amazon, for example. But I think it's valuable. Like the one thing it says to me constantly is that I'm low in protein and dehydrated. And it does make me eat a little more protein. And it does make me drink a little more water. And I think that's of high value for me. So consider getting a bioimpedance scale, just because they don't cost anything. And they might provide some extra motivation for people to participate in a really, really healthy nutrition plan and healthy lifestyle overall. So because I know some of you will probably ask this, what are the optimals here? For body mass index, it's all about the categories that are set out in the literature, right? So the underweight, normal weight, overweight, and obese categories, just follow those exactly as they are. Try to get people into the normal weight category. For relative fat mass, usually for males, I'm trying to get under 20%, but 21, 22% is okay. And for females, it's like 27, 28, 30%, somewhere in that range, okay? You can look up these calculations online, or I can try and put them on the screen after. For some reason, I thought they were on the slide. For waist to hip ratio, we're looking for males to be less than 0.8 and for females to be less than 0.9. Okay, that's the basics. So I'll just review those one more time. Relative fat mass, 20, 21, 22 for males, less than, and less than 27, 28, 29 for females. And waist to hip ratio, 0.8 males and 0.9 females. First up, thyroid. Okay, this is really, really important. In clinical practice, you'll see people come in with a TSH score. So TSH is the basic test that's done to determine if someone is hypothyroid or hyperthyroid or normal thyroid. What it is, it's the hormone that's released from the pituitary gland to tell the thyroid to make hormone. And there's a feedback loop that says when you have enough thyroid hormone, this TSH level is suppressed anywhere from 3 all the way up to 5.0. That's a huge range, right? So what people say is, let's go a little deeper. Let's try and go as deep as we can with respect to thyroid, because the thyroid is so involved in metabolic rate. It's helping to regulate the metabolism of all bodily processes. All cells respond to thyroid hormone by increasing their metabolic rate. So the metabolic rate is their ability to expend energy. Cells that are helping you detox hormones and things in the environment, they need thyroid hormone. Cells that are helping you expend energy on the muscle level to mobilize free fatty acids, they need thyroid hormone to function. When you're making tissues, when you're repairing your tissues, when you're making hormones, every cell's response, every cell's energy output requires a stimulation from the thyroid. And so what I've just done a screenshot here of is a pounds lost trial. And that showed that over 6 months, people with the highest free T and free T4 and free T3, inactive and active thyroid hormone had the best weight loss ability. So regardless of TSH level, when it was in the normal range, if the T4 and the T3 were high, people lost weight more efficiently. Now, what is important on the conventional side for TSH is if you have someone who is sort of really, really excited about integrative medicine and really wants a holistic nutrition plan, and they come in and their TSH is really, really, really high, and they didn't go back to their family doctor yet, or they haven't seen their naturopathic doctor, and we don't know what their free T4 and free T3 is. All we know is that the TSH is above 5. They have hypothyroidism. It doesn't matter what the heck you do nutritionally. It's going to be impossible for them to lose weight until they take the medication to support their thyroid. So this has only happened to me once. We had a person who was down south they were down south for the winter, for example, and they were walking every day and eating extremely healthy and were very, very, very serious. They were only eating 1,200 calories per day, and they were gaining weight like crazy, crazy, crazy. And so we ran the TSH and the level was 40, and it's supposed to be less than 5. And so they were diagnosed with hypothyroidism. And as soon as they started the medication, they lost 30 pounds in like 2 months. It was awesome. So it's really important just to make sure that that's ruled out first. If you have someone coming to you for a nutrition plan, and they've gained weight in the last year, and they don't know why because they haven't changed their diet or their exercise, send them to their either conventional doctor or a naturopathic doctor for a TSH test just to make sure they don't have hypothyroidism. That's really, really clear that it's an important first step. So I put there in the title, the rule out. You got to rule that out if it doesn't make sense that they can't lose weight or that they recently gained weight. In integrative medicine, you might see come across your desk a panel for iodine, selenium, zinc, bromine, cadmium. these are things that either support or disrupt the thyroid gland. So in clinical practice, we do this all the time, and we have people work with our holistic nutritionist here in the clinic to build a nutrition plan. She needs to know what these levels mean and how to support them nutritionally. We make thyroid hormone using iodine and tyrosine, and we convert it with zinc and selenium to the active form of T3. So it's really important to make sure those are optimized. And then we test bromine and cadmium, because you might see this come across your desk. Bromine displaces iodine. It's really, really rare in North America to have low iodine levels, but you can have high bromine levels, which means the iodine doesn't work as well. So that can happen. We've had that happen once, and I was surprised, but glad that we ran it, because it was an easy solution. And finally, cadmium. So cadmium is a heavy metal that damages the thyroid. It's found in cigarettes, and it can also be in the pollution from vehicles. So we really like to do this as a panel, and you'll probably see it as a nutritionist, and you'll know how to support them right away using foods. Thyroid assessments. Let me make sure I didn't miss anything. The thyroid hormone, because it's regulating, thyroid hormone is regulating all metabolism. It's important that it's to know that it's helpful for regulating or metabolizing lipids as well. So, for the clearance of triglyceride, so you're mobilizing triglyceride, you need to have thyroid hormone for this. And then hunger hormone metabolism, was that low levels of thyroid and high levels can be associated with an increased risk in hunger or cravings. And so sometimes when people are taking too much thyroid hormone, they get super hungry, and that's a problem. They can actually gain weight with too much thyroid hormone. But very often what happens is people are gaining weight and have a sluggish thyroid and are still hungry. That's something to make sure you're checking in with, okay, regulating appetite. So on the optimal side of things, you'll probably know this already, but most integrative practitioners try to keep the TSH below decimal 2 and decimal 3, 0.3 and 2.0. And so sometimes you'll see people come in and they're being supported either with a medication or with supplements to keep their TSH below 2, which means to keep their T4 and T3 high. And that's why we're trying to keep it somewhere below 2. Okay, that's it for the thyroid. I don't know, Jason, if you want to tell me about the questions. I can't really see them. If it makes sense to review questions now, they kind of just like pop up on my slide. If it makes sense to review now, we can do it. Or if you'd like to hold off until the end, that's fine as well.
I'll ask you one question here that's related to what you just spoke about. And then for the remaining questions, we'll wait till the end.
Sure.
Do a Q&A at the end. So question here is, what can you do if they can't take thyroid hormones? For example, if they have a bad reaction to taking thyroid hormone.
A bad reaction to taking thyroid hormones. Okay, so there are many options naturopathically. Nutritionally, it's very difficult. If they have hypothyroidism and they responded poorly to Synthroid, the pharmaceutical medication, then we use desiccated thyroid, the bioidentical. And if they respond poorly to desiccated thyroid, then we do compounded individual T4 and T3 prescriptions. And so that's all the medical side of things. Nutritionally, what you can do is you can support iodine, zinc, and selenium, right? Like and tyrosine. That's what you can do. But if the TSH is well above 5, supporting tyrosine, iodine, zinc, and selenium isn't going to have a significant impact. They need to be medicated.
Perfect. Thanks, David. Yeah. And then so for the rest of the presentation, if you want to just, so you don't forget it, you can put your question in the Q&A, not the chat, in the Q&A. And then at the end of David's presentation, we'll go through all those questions.
Excellent. Okay. Thank you, guys. Questions are good. Next up, sex hormone laboratory assessment. Okay. So looking at estrogen, progesterone, DHEA, and testosterone. What the heck goes on with these 4? These 4 are really, really, really important. So you have probably noticed with your clients that they can experience weight change in a significant manner at different times in their cycle if they're premenopausal. So, you can see that can be because of fluid retention and bloating. It can also be because of overeating and the increased consumption of carbohydrate because of emotional eating. And so sex hormones play a significant role to to mitigate those issues that can occur if the hormones are out of balance. In menopause, what we see initially is worse glucose control. So the main driver of weight gain is insulin, which is the hormone that goes up when you consume carbohydrate. When female hormones, estrogen, progesterone, go low, the sensitivity to carbohydrate is reduced just slightly, just enough that there can be a little bit of weight gain. At the same time, there can be changes in mood, which can impact eating patterns. And so it can be very helpful to support the hormones through menopause to reduce those negative effects of the hormone transition. And then low androgens. So DHEA and testosterone for both males and females, when they're low, they are both associated with worse metabolism. That can be through poor energy and poor energy expenditure, so decreased metabolic rate, and also through the loss of muscle mass and the worsening of recovery. So just exercise is not working the same way it was. That's one of the main reasons we like to support DHEA and testosterone. So on the cycle side of things for premenopausal women, what we're trying to do is make sure that we're not experiencing the extremes, and that can help to maintain weight throughout the cycle. And on the menopausal side of things, we're trying to prevent the levels from going super, super low, super quickly, so that we don't have the worsening glycemic control, the glucose control, but also just participating in a low carb, low glycemic diet throughout that period can be so valuable to prevent the 10 to 15 pound weight gain that can occur. And then on the low androgen side of things, if you see it come across your desk, low DHEA, low testosterone, you know right away it can be very, very difficult to lose weight because those are so important in metabolic rate. These tests can be done through blood, urine, or saliva. And each test has a positive and a negative, and you might in your practice see all three options. There are different optimal times to use each one, and that will be covered in the course because there's so much detail. Today, what I'm going to be sharing with you is the Dutch test, which is a urine test, which is very, very detailed. It's the most detailed hormone assessment available. And I'm using that one because it kind of covers everything that we just spoke about. Let's jump right into it. This is a sample Dutch report. This is what they provide. If you go to dutchtest.com, you'll see this, okay? It's a sample report. So it's a urine test that you would do, your client would do over the period of one night before bed, first thing in the morning and 2 hours later, to get an appropriate look at how much hormone is secreted in a 24-hour period and how it's metabolized by the body. And so we get the full cascade of hormone production and metabolism. So then we can properly influence the cascade to support weight loss. And that's really, really what I like to do in practice. So the first thing you'll notice here, you've got a person who comes in, like our case that we're working on right now. They're doing all of these tests. Say they have a normal, I got a request to change the view. Hopefully you could read that to me, Jason. I can't read it. But what happens here? You've got a person come in and they've never been able to lose weight in their adult life. And then they do the Dutch test and you see they're extremely low in DHEA and testosterone. And so what that means, it's likely that they're having a very difficult time holding on to muscle mass, and muscle tissue is highly metabolic. So right now we know their metabolic rate is probably low because they're not holding on to muscle in the same way. So you've probably thought about muscle loss during fasting, like how much muscle loss occurs when you put someone on a fast. And the evidence, if someone's under 65, is like muscle loss doesn't really occur for a couple of weeks. Over 65, it can occur very quickly. Don't fast people who are over 65. But if they're under 65, it probably could take a couple of weeks to lose some muscle mass. This person's going in with low muscle mass, and they're going to lose muscle mass very quickly on a fast. They need to eat and get stronger and improve their DHEA and testosterone levels through natural means. I hope that makes sense. This is like another, like if hypothyroid was an easy catch, low DHEA and low testosterone is an easy catch in someone who's had a very difficult time losing weight. Can you all see this slide? I hope you can see it. I cut it off, so it looks like it's cut off just to fit the screen. I'm just trying to show the DHEA and testosterone cascade here. So how does DHEA help? DHEA improves insulin sensitivity. So some good trials that show that DHEA helps with carbohydrate tolerance. If you have, you can't see the writing. Okay. Like the writing on the page, is it fuzzy or something? DHEA helps with carbohydrate tolerance. So too small. Okay, got it. I can send you the slides after, okay? So if anyone's having trouble reading, what we'll do is I'll send you them after, just message me and I'll send them along, or maybe the school could help me facilitate that. So on the top left, the first, you're very welcome. The top left, what you'll see is DHEA sulfate. So DHEA combined with a sulfur compound. DHEA plays a significant role in insulin sensitivity. Now that's probably due to its effects on maintaining muscle mass. The more muscle you have, the more carbohydrate you can tolerate, because insulin is really, really effective at pushing carbohydrate into muscle so that you can expend it as energy. So if someone has low DHEA, okay, we're thinking about a low carbohydrate diet. I hope that makes sense, because we're trying to help them tolerate carbohydrate better by just making them have to secrete less insulin. So that's DHEA, and we'll go through what optimal is in the course, because there are different optimal levels for different age brackets and genders. This is super variable depending on your age and gender. So that's that one. DHEA has been associated with less visceral fat, so less fat around the organs, and less subcutaneous fat, so less fat directly under the skin. So DHEA, when it's optimized, supports fat loss. On the testosterone side of things, like I said, it's important for lean muscle mass maintenance. And people who go from low testosterone to normal testosterone have a much easier time losing weight. Like, it's like night and day. You may know people who have tried improving their testosterone through natural means and seen the number improve and seen weight loss just get so much easier. So all of a sudden we've got someone who's come in, right, and they've done restriction before and it never worked. And all we've done is help them optimize their testosterone and DHEA levels through strength training and high intensity interval training, and they're losing weight more efficiently. That's that one. Now on the top right there, you'll see progesterone levels. So progesterone in the urine, remember this is a urine assessment, and you can still do saliva. You'll still see saliva tests and blood tests, but progesterone in the urine is a good one. They estimate the amount of progesterone, which is the top value there, by taking the two metabolites and just adding them together. Progesterone in weight loss is a tricky one. You may know people who have started progesterone therapy and gained weight, or gone on to a progesterone-only oral contraceptive and gained weight. When progesterone is sky high, so they didn't test, they didn't have low levels, we don't know what their level was, and they took progesterone as a medication, either orally or on the skin, and they gained weight, it was because their progesterone went too high. That's why if someone's going to start progesterone, they should test first. On the other side, it's a little bit tricky, because if someone is estrogen dominant and they've got a lot of abdominal weight gain or weight gain around their hips, it could be because they have low progesterone and the estrogen's having a crazy anabolic effect. It's causing tissue to go on. You'll see that's exactly what's happening here. E1, E2, and E3 are all high, and this person has a lot of abdominal body fat and a lot of fat around their hips, and they just could never lose it. Never. And so they've got extremely low progesterone and high estrogen. Supporting the progesterone in this case is not going to cause weight gain. It's going to help to balance out the estrogen and support weight loss. At the same time, we try and suppress estrogen. So progesterone and estrogen, it gets a little bit about the details. Next up, let me see if I can switch it. This is the bottom part of that result. On the right there, we're looking at the estrogen cascade. Your main estrogen is estradiol, E2. That's 80% of your estrogen, and that's what's really important here. Estrogen, like I said before, when it goes low, people can't tolerate carbs in the same way that they did. So you see women in menopause, often it's like, I keep eating the exact same way I'm eating, but I gained 15 pounds. Swear, didn't change a thing, and gained weight. With men, for example, when they're converting too much testosterone to estrogen, very difficult to lose weight. They'll develop gynecomastia, which is fat around the chest, and fat in the abdomen and hips. It's because they're converting testosterone to estrogen. The aromatase activity is too high. And so bringing down that estrogen in cases where it's elevated, for example, in that male scenario, can be helpful for weight loss. And bringing up estrogen in cases where females can't tolerate carbohydrate well enough can be really helpful for weight loss. So it's very nuanced. But if you have a person who's had a very, very difficult time losing weight and they're looking at this holistic approach and they bring you these results, you can support them by bringing people back into balance nutritionally. If it's high, we focus on cruciferous vegetables. If it's low, we need to be very supportive on our poly and monounsaturated fatty acids, because that's how we make hormone. Did I miss anything here? Estrogen suppresses appetite. So if estrogen is low, appetite can be outrageous. And so that's part of that can be part of the issue as well. If you can't figure out why the appetite is so high and you see an estrogen test and estrogen is low, that could be part of it. That's why I love functional integrative medicine. We're not looking at pathology here. This person is not sick. What we're looking at is how to optimize them from a functional standpoint. And that's to bring things back into balance. Our client, okay, so we know they have a difficult time. Let's get some more information about them. They don't sleep well. They work 18 hours per day and they can consume caffeine late in the day. Oh my goodness, all day. So that's probably what keeps them up, isn't it? What are we going to do here? So what I'm sharing with you as a case here is my partner. She's shared her case openly many times on our podcast, Healthy Rebel Radio, but also on her blog at damiehealth.com. Her name is Amy Lane, and she's a holistic nutritionist. And before she completed her program, she had a very, very difficult time achieving her optimal weight. And she was crushing it, exercising like crazy, working like crazy, eating extremely clean. When we started dating, she was only eating apples and yogurt. It was unbelievable. You know those old diets back in the early 2000s where it's super restrictive and quite odd, where you just pick a couple foods and that's all you'd eat. What the heck is going on? Definitely participating in significant restriction, but not losing weight and not getting to the place where she so wants to get to, but seemingly doing everything right on the calorie deficit side of things and on the exercise side of things. Something else is going on. You can probably tell from this that stress and insomnia inhibit weight loss. They make it very, very difficult. So you have someone like this who's having a very difficult time achieving the weight loss from their calorie deficit. Okay, the holistic approach is very, very important. You can go into what's called storage mode. Your metabolic, which means just metabolic rate is too low to facilitate the free fatty acid breakdown that you're trying to get. By acting like this, by working like crazy and not sleeping and having too many stimulants. See this all the time, and you will too. Okay, I've got an elegant study done here but on mice, which kind of showed this. This is a cortisol pattern. So cortisol is your stress hormone. On the left there, you see a normal cortisol pattern. Secrete a lot of cortisol in the morning to get you up. Over the course of the day, it goes down, down, down. It goes up a little bit when you eat and when you're a little bit stressed, but overall, it just gets super low when you sleep. The people who have a normal cortisol pattern, high in the morning and low at night, have an easier time losing weight. Those are the people who aren't experiencing chronic stress. On the right, and this is done in mice, but it can be replicated in humans, no problem. On the right, we see a flatline cortisol pattern, but it's kind of elevated, right? Like it's a little higher than the lows that on the left, what they're seeing at night. These mice could not lose weight. So the cortisol, even though it's, a little lower than those peaks you see on the previous day, the cortisol is preventing weight loss. And so this is the fight or flight, right? This is having a little bit of stress hormone all the time. I'm drinking caffeine all day. I'm never sleeping. I have a high intensity job. I'm doing all of these things. I'm even exercising. I'm not eating very much, but it's not working. So why the heck does this happen? Well, stress hormone helps you dump carbohydrate into your bloodstream from your liver. So you store carbs in your liver and in your tissues. And they're mobilized when your body thinks that you need to run from wolves, right? That's the whole fight or flight aspect of this. If you are taking stimulants and not sleeping, and pushing it, you can have a continuous release of cortisol, and that can cause a continuous release of carbohydrate, and that can cause an anabolic state, a state where you're trying to build tissue, or mobilize energy so you can run and participate in the day. But see, you're not burning it off at the rate that would facilitate fat loss. As well, cortisol tends to stop the breakdown of fat because the body thinks it needs to go into this preservation, right? It's going to be dangerous for a long period of time, so we need to preserve tissue. That's the kind of signaling that happens in fight or flight. Cortisol can be tested through blood, saliva, or urine, and you may see all three. I think I have a urine one. Here's the urine one from the Dutch test. Oh, and by the way, in the course, we're going to go through all the functional laboratories that are available to holistic nutritionists as well. It's not just integrative practitioners who can run labs. You'll see them a lot, tests that aren't available to you, but you can also run some labs, some functional labs across North America. So I'll try and highlight those in the course. You'll see on this page here, I'll direct your attention to the top right. That's metabolized cortisol. That's how much cortisol was secreted over the period of 24 hours. You can see it's on the high end. The normal range there is between those stars. That green semicircle, that's the normal range. They're at the very, very top. But then you look down at the patterns of release. Those are those two graphs on the bottom there. It looks like they're on the bottom end. Their levels are the red, right? And they're at the very, very bottom. It looks like they're flatlined. It looks like they have chronic fatigue, or they are not making any hormone. But we know from the metabolized cortisol, they're making so much. Metabolized cortisol is 97% of your adrenal production. And so these people are in adrenal overdrive, but the amount in free circulation is quite low. They're burning through it quickly. So they've got a high metabolism of the hormone. But this can cause difficulty losing weight in a significant way. And so the urine tests are the only ones that actually give you the difference between free cortisol and urine cortisol. I really like this one. Next up, insulin. Okay, so insulin is the main driver of weight gain. That's why people do low carb diets. That's why people go keto. That's why people get stronger, exercise more. It's to manage carbohydrate intake. In North America, it's very easy to get carbohydrate all day long. Cereal for breakfast, sandwich for lunch, and pasta for dinner. Directing people away from that type of lifestyle is what we need to be focusing on to help people recover from being overweight and obese. The purpose of doing that is all to manage insulin. Now, we need to be as specific as possible. Are you going to see a lot of insulin tests come across your desk? Probably not in the next couple of years. But in the future, you will see a lot. What will you see come across your desk? You'll see fasting glucose, so fasting blood sugar, and you'll see A1C, which is the average blood sugar over 3 months. You might also see people use this device that's in front of you here, which is a continuous or flash glucose monitor, which is a little sticker that has a tiny needle in it that people wear for 2 weeks that can tell them their carbohydrate, their sugar, at every second of every day. It's amazing. It guides nutritional therapy like crazy. It's the best. If you're a nutritionist, you must be thrilled that these are available. You can see how someone responds to carb immediately when they eat it over the course of 1 hour, and then 2 hours, you can see how the carbohydrate, the glucose falls in the bloodstream. So you can see how sensitive they are to their insulin release for every single thing you give them to eat. It's amazing. In the clinic here, how do we use this? We put these things on people, we set up their devices, and then we give them a nutrition plan. We say, okay, in the first week, try to just, sort of learn about how food impacts you. How does your sugar go up and how does your sugar go down after every single meal? How is it first thing in the morning? How is it when you're sleeping? This device saves 8 hours in a row, so we can basically see every second of every day if they only scan it 3 times a day. It's really simple. If the levels are going high, we know that insulin is going high, and that's the reason they can't lose weight. They've just got too much insulin around. Insulin causes people to hold on to weight, and it causes tissues to develop. It's anabolic. You probably know people who are trying to gain weight, to put on muscle mass, to get bigger. They're eating carbs. They're having their insulin go up to grow. It's why we give corn to animals and we overfeed them. It's to make them grow. Give them carbs, they get bigger. That's because of the insulin that's released when you eat. It pushes the carbohydrate into the cells, and if you're not moving around, you don't expend the energy that would be required, that would be given by the carbohydrate. This device has changed my practice in a significant way and allowed me to facilitate specific nutrition plans to every single patient. You're going to see people come in with this who have type 2 diabetes. You might even see people who don't have type 2 diabetes wearing these, and you can help them learn everything you can about it right away. I encourage you to do that because it's amazing. Assessing insulin resistance with HOMA-IR. The next test that you'll see is fasting insulin. Fasting insulin is my favorite test in weight loss. If I leave you with one thing today, it's that we need to get everybody a fasting insulin test. I just had a question that said, what's the device called? It's called the Freestyle Libre by Abbott. And there's also one called Dexcom G5 that I don't think is available in Canada, but it's in the States. I use the Freestyle Libre by Abbott. Insulin resistance assessments. How do we know if someone is sensitive to carbohydrate or not? How do we know if they need to become more sensitive by putting on muscle? It's with a test called HOMA-IR. This is the easiest one in clinical practice. If you see a fasting insulin test come across your desk, you need to go to the blood code, I think it's .com, just Google the blood code and plug in the numbers so you can determine what the HOMA-IR is. This should be part of your daily practice if you're seeing a lot of these labs, so you can facilitate the low carb diet and strength training for people properly. If you prescribe exercise, for example. So HOMA-IR, the hemostatic model of insulin resistance, is one of the easiest ways to assess if someone is sensitive to carbohydrate or not. And it's extremely motivating. Optimal is a score of less than 1.9, and good is a score of less than 2.9. When they go to the lab, they get a fasting insulin test, they get a fasting blood sugar test, and we just plug in the numbers and we get the score, and then we can build a nutrition plan from there. So cool. You'll also see oral glucose tolerance tests where people will consume sugar and then they'll see how their insulin and carbohydrate is after 1 hour and after 2 hours. That's fine, but you have to drink so much sugar to do that. It's better to have a Freestyle Libre, I think, to assess how people are responding to their current diet. So HOMA-IR is the first thing I do in every weight loss case, and it's just the best. Okay, so that's it for carbohydrate management and insulin management, okay? Insulin is the most important thing. If you leave today with anything, it's that you're thinking to yourself, why am I using low carb? Why am I considering the restriction of calories by restricting carbs is to keep insulin low. And if you're not doing low carb, if you're doing low total calorie, why the heck does low total calorie work? Low total calorie works really, really well when people are sensitive to carbohydrate. And so they're already good to go. That's why most men who have decent muscle mass can lose weight just when they slow down their consumption. It's because of their muscle mass. Like we said when we were reviewing the fat max scores earlier, women need to have a little more fat on their body than men because they need to be able to make hormone and store hormone appropriately. And so they can have a little bit more difficult time tolerating carbohydrate. The insulin resistance score is a really, really good way to assess that. Now, what about metabolic testing? So resting metabolic rate, I assume because you're a nutritionist, you're looking at how many calories people are eating and helping them cut calories if they're trying to lose weight. You're probably doing basal metabolic rate assessments, which is fine and good in clinical practice, and keep doing it if you don't have access to one of these devices. Learn how many calories you think someone needs and reduce it if you want them to lose weight, and teach them how they're going to lose weight if they continue with a little bit of deficit for long term. What's really, really awesome is resting metabolic rate tests. And if someone in your city has this, send your clients to them so they can get their metabolism tested. What you're seeing here is an example of the numbers that are produced when someone just lies on the table and breathes into the machine for 10 minutes. On the right-hand side there, you'll see mean EE, which is mean energy expenditure. It's 1,960 kilocalories per day. And so after 10 minutes of lying on the table, or in this case, she did 8 minutes and 23 seconds, I think, they estimated that over the course of the day, if they just lied on the table all day, the mean energy expenditure would be 1,960 calories per day. And that makes it really easy, right? Like now we know. Now we know if we do anything less than 1960, we'll be in a deficit. If we exercise anything more than just lying around on the table, we'll be in a deficit as long as we're eating less than 1960. This changes everything. And so this is how we assess resting metabolic rate. And I think it's the most precise way of doing it. It's super awesome. Not everyone's going to have access to one of these machines, which is fine. You can estimate these numbers with calculators for basal metabolic rate online. And then active metabolism testing. This is what happens next. So someone has just done a resting metabolism test. Now we put them on the treadmill, keep the mask on, and let's see how they burn calorie. So this is what's called a ramp test. The green line represents how intense the treadmill was. And so every minute for 9 minutes, the test got a little bit more difficult on the treadmill. The purple line there you'll see is the pink line, I should say, is the heart rate. The yellow is when they're burning free fatty acids fasted. The purple is when they're burning carbohydrates fasted. So you'll see there in the first part of the test, this person is only burning free fatty acids fasted. That's why people exercise fasted for their slow, long distance, what's called continuous medium intensity training or steady state training. Train at that heart rate where they're burning the most fat but not touching the carbs. That's fat max training. And that's when you're metabolizing those free fatty acids that are in free circulation, getting into fat burning mode without going keto. Still eating carbs. They just woke up, went for a walk at the heart rate that was conducive with the fat max. And so that's what we like to do in the clinic here, just because we're fortunate enough to have this device. But you can calculate, you can estimate fat max for people. And if you're helping people safely do fasted exercise, or if you're teaching people about fasting and the value of it, you can refer to this chart. This is very, very typical. If someone is not intensely exercising, they'll only be burning free fatty acids if they're fasted for more than 12 hours. This is after a 12-hour fast. You'll see as the heart rate goes up and up and up and it gets more intense, the metabolism of free fatty acid goes down and they start mobilizing stored carbohydrates so they can really, really push it. And that's how the zones of training are calculated in clinical practice. But as a nutritionist, what you know is here, if you want to make sure someone is storing enough carbohydrate to participate in high intensity exercise, this test can give them. It's called the PNOE, P-N-O-E. And that's what I like to use in clinical practice. Someone in your city might have this. And if they do, it's highly valuable for weight loss. It gives us everything on the exercise side of things. What do we need to do specifically to train to get fitter, to work on mobilizing free fatty acid consistently with steady state training, what heart rate that should be at, and everything in between, zones 1 through 5, how to properly train and eat to facilitate those zones. So exciting. This is what a typical scoring looks like. The most important one for weight loss, there's two really. On the middle, on the right side, you'll see fat burning efficiency, which is when they're going at low heart rates, how much fat are they mobilizing to clear? That's the efficiency score on that side of things. But where people go wrong, and in this case that we're reviewing right now, what you would see on the top left, metabolic efficiency, you would see that as a very low score. When they exercise, they don't burn very many calories. I have a lot of people who only burn 20%. That score is on the top left when they're in storage mode. And then the training zones are provided by this test. So they get to see zones 1 through 5 and the heart rate for each zone. So how to do zone 1 steady state cardio, how to do zone 4 and zone 5 active metabolism, high intensity interval trainings, whether it's 3-minute tempo trainings or 90-second sprints. These are the heart rates that based on that previous assessment I showed you, this person would need to be at. So cool, and really guides how to practice exercise properly for weight loss. And then finally, you'll see the fat max. So right in the middle of the page there is the heart rate when that person burned the most fat fasted. And that's that fasted cardio piece for those who have very difficult time losing weight. They should train 45 minutes at a heart rate of 137 for this person to burn the most fat efficiently without tapping into the carbohydrate. So helpful to know that. Test is called PNOE. It's an in-office metabolic test. You might see some of those if you live in Vancouver, just because we have one, but other cities, there are people who have them as well. So you might start seeing those. What you'll see all the time is cholesterol tests. Cholesterol tests are helpful on a weight loss plan because the triglycerides are there. Triglycerides are storage forms of carbs and fat. And triglycerides are really important to see because they tell you how a person's eating. If the triglycerides are not going down, it's likely that they're still eating too much saturated fat and too many carbs. And so their body's trying to store extra energy in the form of triglyceride. It's the most sensitive lipid measure to diet. And so if someone comes in and they show you their cholesterol panel and you see the triglycerides and they are where they are, then you put them on a plan. Then 12 weeks later, they get their routine cholesterol check again, and the triglycerides haven't changed. It's unlikely that they followed the diet protocol properly. Really, really helpful in a nutrition practice. It's my main go-to when I'm checking up on a nutrition plan for the storage of free fatty acid. That's through just assessing simple triglycerides. Become very familiar with them and try to help people reduce them. What we're really looking for here on an optimal side of things is not necessarily a specific triglyceride score. We're just trying to keep them low, keep them improving, getting lower as you go. But triglyceride to HDL ratio should be less than 0.6 or so, at least less than 0.1. The triglycerides should be less than the HDL. In the course, we're going to get into detail about why that's important for heart health. But on a weight loss protocol, I really want to make sure that triglycerides are less than HDL because it really signals that someone's following a low calorie diet in the form of low saturated fat and low carbohydrate. If you can't tell, that's, I think, what's an appropriate diet. Is just keep carbs moderate to low and keep saturated fat low. Finally, what else do we need to know? You'll see come across your desk probably HSCRP, which is C-reactive protein. It's a measure of inflammation. It's important to know because if someone's very inflamed, they may have leptin resistance. They may not be responding to their hunger signals. So when someone has some weight that they need to lose, they should have an appropriate amount of leptin telling them to stop eating because fat cells make leptin. It regulates hunger. But sometimes it doesn't work. And why doesn't it work? It doesn't work because of leptin resistance. Leptin resistance can occur when someone's inflamed, so they've got elevated CRP. It can also occur just when they've had too many fat cells on their body for too long of a period. And so I like to test inflammation in these type of cases. Homocysteine is a measure of B vitamin usage, folate and B12. If someone's homocysteine comes across your desk and it's elevated, you know they need some support on the B vitamin side of things. Adequate vitamin D levels are associated with an easier time losing weight and maintaining their weight loss. Vitamin D is really important for all of us, but it has a role, and it has a role in a healthy metabolism, seemingly. When people improve their vitamin D, they have a little bit of an easier time losing weight and keeping it off. So cool, so cool. On an energy side of things, iron and B12, incredibly important. We need to be making red blood cells to distribute oxygen to the tissues so that we can actually participate in an appropriate metabolic rate. Oxygen regulates that process. And so without enough iron and B12, you can have the metabolic rate slow down to a significantly slow pace. You can also have energy just totally subjectively come down, which means people won't exercise. So optimizing iron and B12, a really, really important part of a nutrition practice for weight loss. It's something that sometimes the only thing that comes up is iron deficiency. And it's like, okay, I'm trying my best to lose weight here. And the only thing I'm seeing is that I'm low in iron. Well, let's support the iron and see if it helps. And often it does. Often it does. Not just through the production of energy and the ability to work out more, but the ability to keep stress low, for example, the ability to have a strong metabolic rate as well. And then hours slept per night. We need to be sleeping adequate amounts to release what's called adiponectin. It's a hormone that helps with metabolic rate and fat metabolism while you sleep. If you don't sleep enough, you don't get enough adiponectin, and then you just can't lose weight as efficiently. And you're missing out on that one piece. And that one piece could be everything. How did our client do? So in this case, of course, it was Amy. And we figured out that her adrenals were completely messed up because of her lifestyle, too much caffeine, not enough sleep, pushing it. As soon as she regulated her lifestyle, she had to eat a little more calorie. When she ate a little more calorie, her exercise was a little more efficient. She got a little stronger, got a little fitter, but also she started sleeping better and started losing weight like crazy. And it worked like a charm. It always feels weird when you tell someone they need to eat a little more to lose weight, but it's actually quite common. It's actually quite common. And so if you start to see deranged metabolism cases in your clinical practice, think about this holistic approach, please, because it's so, so valuable. So we reduce caffeine, we reduce stress, we improve sleep, and we actually ate a little more calorie. And then it just started working like right away. Amazing. So that's a holistic approach to laboratory assessment for an appropriate weight loss plan production. This is the framework that I use in clinical practice, that holistic nutritionists can use in their clinical practice when they see labs come across their desks. Become knowledgeable about this little seminar we have here today, and your clients will benefit for the rest of your career. You'll be able to pinpoint places where you can have a significantly positive influence on someone's longevity by helping them achieve a normal weight, simply by diet when you optimize the labs that we reviewed today. It's really, really awesome. So my course is coming up about laboratory diagnostics in clinical practice, not just about metabolism and endocrinology like insulin, but also we're going to talk about all the labs you'll see from a conventional and functional standpoint in clinical practice, so you can develop evidence-based nutrition plans. I hope that you all will join me for this. It's going to be super exciting. It's going to be me on the camera with hopefully some really good slideshows if I can get good at making them. And Jason's going to go over how to sign up. What we're going to do in this course, I should say, because it's a systems approach, is we're going to try and review all the common concerns that you'll see in clinical practice and what conventional and functional labs to look for and how to optimize them. So common concerns. The first one is inability to lose weight, right? Covering that today. We'll go into more detail in the course, but that's how we'll look at it. So systems and common concerns at the same time, so you can individualize your nutrition programs for clients. It'll be a 7-week CE. It's going to be every single week for 3 hours, I think for seven weeks in a row. To reach out to me, I'm available anytime. You can email me or call me, or you can connect with me on social media if you need to. Those are my social media handles there on the right. I've got a podcast called Healthy Rebel Radio. Please tune in so you can listen to my wife and I rant about nutrition and health. And that's my clinic, Noble Naturopathic, where we do all of these things. And, you know, if you ever need support, you can let us know. I'm obsessed with all of these labs, if you can't already tell. Did I miss anything about that? That's it. And then I think that's the last one. Okay, we did it. Right on an hour almost. Oh, an hour and 4.
Awesome.
Sorry.
No, that was awesome.
Questions.
Thank you. Thank you so much, David. That was really awesome.
Woo, that was a whirlwind. We did it.
And yeah, just to add a little bit more detail. So as David mentioned, understanding lab diagnostics and clinical practice, that's coming up. So March 2nd is the first Tuesday, and it'll run for 7 Tuesdays in the evening. So that's 3 to 6 Vancouver time, or if you're in the Eastern time zone, 6 to 9. You can just email me directly, Jason at Institute of Holistic Nutrition, and I'll either help guide you to registration or at least get you in touch with someone who can get through all those details for you. And if somebody is unable to attend at that time, but really interested in the course, still reach out. Depending on the circumstance, there might be opportunities where we can set you up with recordings of the lectures and things like that, so you can still partake and get the content. So we want to make sure that we can include everyone, and registration deadline is February 25th. So, you know, definitely get on that and start planning and reach out to us so we can get you in there. Okay, with that, we're going to run through some Q&A. I see lots of questions rolling in, and then we'll do a draw for the big prize.
Oh, awesome.
Okay, and I apologize in advance if we don't get to all the questions. Obviously want to be respectful of David's time, and like he said, he's very generous. So if I don't get to your question today, then certainly, feel free to email. Okay, so let's see. For hormone testing, what phase of a woman's cycle should they do it for best results? Luteal, follicular, or do you just note the cycle phase and have different optimal values depending on what phase they tested during?
No. So for weight loss, normally we're testing in the luteal phase, that day 21, day 19 to 21.
Okay. Talking about high estrogen with excess weight around the abdomen and hips, how does that come into play in women with genetics, which would maybe give them bigger hips? For example, African Latino cultures, are those purely genetics, or is there predominantly higher levels of estrogen in some cultures?
I don't know. I haven't come across it. I would test and find out.
Yeah, it's a great question. Will chronically high cortisol cause fluid retention?
Will it cause fluid retention? Yeah, I think that's what happens. When people take prednisone and they gain weight right away, they do gain weight, but they also they retain a lot of fluid. So chronically high cortisol could do the same thing. I'm trying to think about Cushing's disease. So the condition of significantly elevated cortisol is Cushing's disease, and they gain a lot of weight. I can't remember if they retain a lot of fluid as well. Great question. But we see it with prednisone usage, so why not?
Could you comment on the role of lectins in weight gain loss? Some people I know have lost a lot of weight on lectin-free diets. Thoughts or opinions?
I love Dr. Gundry. He's awesome. I don't use it clinically. I think that there's people who have sensitivities to anything. Sometimes people find that they have lectin sensitivities and they reduce them and they feel better overall, which translates into an easier time losing weight. We didn't talk about digestive assessments here and how the immune system, upregulation of the immune system can really hurt metabolism. I think that's what he's talking about there. It's where the immune system goes on high alert because of the lectins in the diet. For some people, it really, really happens. I don't see it clinically, and I don't think about it very often. But we do a lot of inflammation testing for food specifically, and every single time we do it, we see at least one or two beans come up, right? Like they're all, and this is IgG delayed hypersensitivity tests. Every single time we see some beans test positive, and say, oh, geez, you need to avoid those beans. It's like all humans have some reaction to some beans. And I swear, every single test, there's some IgGs. Now, not all IgGs cause symptoms. Every time you have an IgG, there can be some that are merely for surveillance and they don't cause clinical problems. Could they be worsening metabolism? It's possible. People who avoid them, sometimes they do really, really well. So I'm not like gung-ho about it, but I see what he's saying on the whole health side of things, like on the weight loss side of things. I think that if someone has a sensitivity and they avoid it, they feel a lot better. People who have sensitivities to gluten and dairy and they avoid them and they lose weight like crazy. Like the Whole30, for example. People lose weight doing the Whole30. It's awesome. And it's likely because of this whole system benefit that people get from participating sometimes in a more restrictive diet that has maybe less of an immune response. That was a bit convoluted, but I think it's true.
So what if somebody is not breaking down fats properly? So it's not so much that they're eating too many fats. Would the triglycerides marker be an accurate assessment in terms of diet adjustment?
So they're not making too many fats, but they're not breaking them down properly. Okay. So maybe we're thinking about in liver disease. Like not mobilizing fats. Like one of the reasons people go keto is to try to help them mobilize free fatty acid better. I really think part of this is simply too much carbohydrate glycogen storage. So people eat carbs forever and ever and ever and never exercise properly. And when they start exercising, they go too intense. They go crazy. And they're getting into that zone 4, zone 5 training right away. You saw at the end of the graph where you're just mobilizing carbs. That helps to get fitter. Like we have a lot of fit people come in who have had never been able to lose weight. And it's because they're never tapping into their fat stores because of the way they're training and the way they're eating. And so I think was the question, how do we fix that? We fix that by having more lean muscle mass. So muscle has a higher metabolic rate than fat tissue. And so people say, oh, you can't spot treat and you can't, when I lift, I get bulkier, all this stuff. No, when you get stronger, when you have more lean muscle mass, you have a higher metabolic rate, and the muscle helps you burn the fuel that you have stored in those fat cells. So over time, like sometimes it's like, okay, you need to eat and lift for 8 to 12 weeks. It's really tough. You need to eat above that resting metabolic rate and lift weights. And then at 12 weeks, we start doing restriction and the weight comes off. Fats are mobilized. Woof. And that's how we do it. Metabolism correction, progressive overload, fat max training, and some high intensity interval training just to maintain that aerobic fitness that they worked so hard to get. What was the question?
I think you answered it.
Great.
What would be the best way to lose weight after giving birth? How do we balance that carb intake versus breastfeeding needs, etc.?
So you have to eat a few more calories. I think it's 300 or 350, maybe it's 400 when you're breastfeeding. Who I was mentioning, the case we were mentioning earlier, Amy, she's been breastfeeding for 4 years. How do you do it? How do you lose weight? First of all, it shouldn't be your focus unless you're in the obese category. Then there can be some deficit, right? Try not to just enjoy this period of life. It's really, really important to continue to maintain the calorie requirement that you need to make breast milk. That's first. Second is there's an opportunity here to improve metabolic rate and keep eating. And that comes from building more lean muscle mass. There's this training protocol where you do every single muscle group 4 or 5 times a week. And you have some intense sessions where the last couple reps are really difficult and force you into that hypertrophy where you're getting a little stronger, a little more lean muscle mass, but you're not getting bulkier or bigger because you're not eating more. You're eating the same amount, but you're doing this whole body workout where you're getting a little stronger throughout. Metabolism is up for a few hours, maybe even a day after. Next week, you're even stronger. Next week, you're even stronger. And that muscle mass is highly metabolic. And so all of a sudden, maybe you're having a body composition change during the breastfeeding time. Like maybe you're getting a little bit more of a V taper if you're focusing on the lateral shoulders and the low back and the core. And you're getting a little stronger. And then all of a sudden you reached 2 or 3 years, or however long you're going to breastfeed, and you do a calorie restriction and you lose weight like crazy because you've got so much good lean muscle mass. And I hate to be the exercise guy, right? Like I used to be the exercise guy and then I wasn't, and now I am again, because I think it's so important because I've been doing low carb and fasting for so long. It's not always the appropriate thing. The appropriate thing can be, let's take metabolic rate up by doing this step, that step, this step. And breastfeeding is one of those cases where it's a great time to get stronger. Awesome. I'm eating more.
Mm-hmm. Awesome. Now I know you're gonna talk more about testing in the actual course, but in terms of the tests that you talked about in today's webinar, are there any of those tests that holistic nutritionists can order on their own?
Oh, I think so. I'm going to try and put all that together in the course. It's a little bit hard for me because I'm signed up with all the labs, and
Sure.
It is what it is. But I think a lot of them can run, because I've seen some of them come across my desk that were actually ordered by holistic nutritionists. So yeah, I can't do it right now. I'm going to have to do it next month. Well, for the start of the course in March. Sorry.
No, it's all good.
But these ones, Life Labs, conventional assessments at Life Labs, no. But if you're working in integrative practice, like our holistic nutritionist here, we facilitate labs to support her clients. And so they become part of the practice, right? So if you're working in an integrative setting, you can look at it as a team-based approach. Approach your client with that in mind. We've got an awesome team here. Do you think that we could work together to make this happen?
Great. What would you recommend to support adrenal stress, energy, stamina in terms of supplement help?
Supplement help. Okay, great. So it depends on the type of adrenal insufficiency that's being experienced, right? Like if they have super high cortisol in the morning, but a normal pattern, like it gets lower during the day, then maybe they need to be participating in some cortisol suppression. So the best evidence is for phosphatidylserine. But approaching the other side of the nervous system, which is to support GABA by taking some theanine. Theanine has really great evidence for anxiety reduction, and that's from its ability to make GABA go up. And so just matching the nervous system by doing some theanine, that's in that case. If it's disrupted circadian rhythm, so they have low cortisol in the morning, but high cortisol at night, usually we're suppressing cortisol at night with herbs. I like to use ashwagandha, magnolia, and phosphatidylserine all at once to bring down cortisol at night. And we boost it in the morning with things like B5 and licorice if they don't have high blood pressure. Vitamin C and magnesium are really important. And I like Siberian ginseng. And if they really are low, we'll use Panax ginseng. And a good resiliency one that we like to use is rhodiola. And of course, there's always some considerations with medication interactions that need to be confirmed. But on a nutritional side, B5, vitamin C, magnesium, these are essentials for those low states. And then in the chronically burned out, so low, cortisol across the board, mitochondrial support. So thinking about CoQ10 and L-carnitine, and we're thinking about NAC and even NAD boosters like True Niagen. I'll use sometimes to help support mitochondrial function, and then trying to regulate circadian rhythm and cortisol release by doing more stimulating things in the morning and more calming things at night if there's any room, but don't suppress it too low because it will disrupt their sleep patterns. So that's a little bit of detail about how we do it. Think about the nutrient side of things and how those nutrients play a role in the lifting and suppressing of cortisol. And if you go to PubMed and you put in B5 and cortisol, you'll see what it does, right? Vitamin C and cortisol, you'll see what it does. You can do your own research there to build your own plans.
Awesome. Okay. If I didn't get to your question, I apologize. But we're gonna stop it there. So we're gonna do the draw. So I got everybody's.
Thanks for your questions, guys.
Yeah, I got everybody's name in this bowl. So maybe while I'm shuffling them around and juggling, maybe David, you can tell us a little bit about the supplement line. And
oh yeah, great, thank you. Yeah, okay, so our supplement's called Noble by Nature, and we are right now we have an immune line. So astragalus, vitamin C, capsule powder, vitamin D, zinc, and then we did one wild card, which was a high dose B12 for those vegans. My wife's a vegan, and so we started the last weekend of November, and we're super excited about it. We hope that it's the basics that people will turn to make sure that their nutrient status is appropriate to keep their immune system vigilant at this time in human history. So we like, yeah, I'm obsessed. High quality, really great lab making them, and they look nice and they feel nice, and it's the whole thing.
Awesome. Okay. Just imagine a drum roll. Jared Cox. So
Jared Cox, congratulations.
Yeah, so I have everybody's email as well, so I'll get in touch with you tomorrow morning, and then we'll figure out how to get everything over to you. So awesome, thank you, and thank you everybody for attending. It was a great evening. Hopefully you got something out of it. I know I learned something today. David, thanks again for your time, and look forward to having an awesome Con Ed in a few weeks.
Okay, great. Sign up for my course, you guys. Come join me for a few weeks and we'll go through all the details.
Awesome.
Great. Okay. See you guys.
Yeah.